Well, as we mentioned, as we head into the colder months, the risk of injuries from slipping and falling on snow and ice only increases, and the elderly are at especially high risk of fractures from these falls. Dr. Benyamin is the founder and president of the Millennium Pain Center. He joins us now live. So the elderly are at a higher risk of this. Is that primarily because of osteoporosis?
Yes, Ashley. You know, actually our country is facing an epidemic with osteoporosis. More than 40 million people are affected by it. Worldwide, this is over 200 million people. And when you have osteoporosis, you know, women over age of 80% of them, you know, they have osteoporosis, and 40% of them, they end up with some kind of fracture. And it's very common to see wrist, hip, and vertebral compression fractures.
So we're talking a compression fracture. What exactly is that?
Compression fracture is where you have a collapsed bone in your spine. And you don't always need to have a fall or a trauma. Sometimes it could happen by just cough or sneeze in people who have osteoporosis. So it's very important that we diagnose osteoporosis, we address it, and we treat it, we prevent it so that it doesn't get to the point that a simple cough can cause it to fracture.
Now, it's very common, but I imagine it's hard to treat if you can't exactly see it or, you know, fix the bone. How do you go about treating it?
So you have to be aware. Whenever you see an elderly female with history of osteoporosis, they complain of a sudden, intense pain in the mid-back or lower back, the first thing that should come into your mind is, oops, maybe she has a compression fracture. So doctors in the emergency rooms and urgent care places should be aware of this.
So what are some treatment solutions?
Well, the major thing is prevent, and there's a lot of new medications in that field, but once you get the fracture, basically the biggest advance that we've had since 2001 is to be able to put a needle in the fractured bone and inject some different kind of bone cements that will stabilize the fracture and relieve the pain.
Okay, now we should also mention that you're the assistant professor of surgery at the University of Illinois, Champaign-Urbana, and you guys have now opened a new location in Peoria at the Millennium Pain Center. So,
yes,
Dr.
thank you very much.
Benyamin, thank you for being here. We'll put up more information on our website. Well, there's more Live at 5 ahead. Stay with us.